I was diagnosed 14 years ago by Dr. Lee Borland, stage 3 breast cancer. So soon after that, I had several surgeries. At last count, I get up into the 20s and I lose count, over 20 surgeries here, and 12 rounds of chemo over the years. We're on our 15th year, and 2 rounds of radiation.
It's a dramatic change in your life to hear that word. It hit my gut hard.
When I first heard I had cancer, and then when he first heard me tell him I had cancer, that's the worst part of it. You cry, you go to sleep, then you get up, and you start, tackling it. It changes your life.
You never want to hear it, and you definitely don't want to hear it for your loved one. I mean, as a guy, I guess you always you'd rather take it on and let me deal with it, and you can't.
All of a sudden, I've got my wife who's got breast cancer, and is it 1 month? Is it 1 year? I planned on a lifetime with her.
One of the nurses walks out and can obviously see that us, I'm sure like anyone else, has tremendous fear of what's going on, and she came up and just basically said, I just want to let you know everything's going to be okay. We do this all the time, and you're in a bad place right now, but we're going to fix this and get you to the other side. We are with the best. We are with the people who are leading this industry and doing this, that have the best gear, that have the best facilities, that have the best people. So that's incredibly reassuring, and it happened with every
piece.
Moment of what we had. We kept looking back going, wow, okay.
Our hospital stands out in treating patients because there is the skill level that the patient needs as far as getting taken care of, and also the compassion that we have for every individual that comes through.
There's a warmth here. There is a warmth here that goes throughout.
Just feeling that everybody was so confident that we were dealing with, but at the same time through all of it, it's been, I think, the compassion and care. Not this kind of mushy pity kind of thing, but just a true compassion and care and understanding, and feeling that we were in the best hands.
Feeling like you have a team of doctors, wow. That feels good.
When Dr. Borland and then Janice, his nurse navigator, explained about how they have these meetings, the surgeons and radiologists get together prior to the surgery itself, that all sit together in a room and evaluate everything.
So all of your second, third, or 10th opinions are being done right at one time.
All the healthcare team works together. Could be the oncologists, radiation, and chemotherapy, and they present cases and they kind of collaborate. They go over the cases with everybody that's there for the conference, so everybody knows what's going on with that patient, and that way they're looking at the whole picture, not just one thing, with each team. Everybody works together for the best possible care for that patient.
Every time we're over here, I know that she's got everybody's attention, and every doctor is, I know, focused on her, and they've all got ideas and plans. I really don't worry.
I feel like another hospital might have given up earlier, whereas Presbyterian, they've never given up on me, never. Always, positive about my future and my prognosis.
The cases aren't always good, maybe the outcome's not always what they want, but it's just knowing that as a healthcare professional, and this is what we do, through the good times, the bad times, the ups or downs, not everything's going to be exactly how you want it, but just being there for someone while they're going through this process it's a huge reward for me.
I've had the best care. I've been totally confident the whole time. I feel like my life's been extended. I've come back several times, from what might have otherwise been a tragedy, looking like I was at death's door in the hospital, and something brings me back. I mean, it's the good Lord above, and it's good doctors.
I don't know what else to say. You can say thank you, but it's so far past that. The gifts they've given us as a family, to have her, still here with us. It's a blessing.
It's in these challenging times where the true stars shine. I mean, yes, we're lucky, but I think everyone who walks in here is probably lucky, if that's the case.
To have another day, to have, you know, to have more time together. It's been, so, living the day, the weeks, they've given us more time together, and I thank them for
What's
that.
more precious?
What's more precious?